right, cool. We got some questions. Hey, man. What's up, Hulk? Question. All right, ask your question, Miguel. I set it to slow mode or to use the French word, retard. So if you ask a question or if you type something, you have to wait 6 seconds to ask it again or to type something else out. So if you're going to like say question and then not ask the question, you have to wait a whole 60 seconds to ask the question. So you should probably just ask your question. Right, I'm going to move this back. All right. So no one asked. Am I supposed to scroll down to see your question? Oh, well. All right, no one's asking questions. Well, the people at home are going to be bored. So I'm just going to get started with, let me see if this works. Hello. All right. Oh, how is your cycle coming along with your goals for Texas? Okay, so everything's looking pretty good. I put some pictures up on Instagram, and I'm almost, I don't want to say I'm running ahead of schedule, but it's quite possible I'll be ready for Atlanta and or Chicago. So I'm like contacting promoters and discussing it with my videographer that I was going to have come with me and trying to arrange tentatively to do both of those shows. So it's a little complicated. Like I'd have to fly into Atlanta and then fly back from Atlanta to Detroit, and then I can drive from Detroit to Chicago. So whether I do Atlanta or not doesn't influence my ability to do Chicago, and doing Chicago can't negatively influence Atlanta. So it looks like I probably can do Chicago no matter what. And I'm talking to Tim Gardner right now via email about doing that show. I haven't heard back from Lenda about the show. I mean, you don't need their permission, but I want to get some questions answered. Because like things that factor into it is like if the Detroit Pro did a black curtain for the backdrop and it looked amazing. It looked like it did 10 years ago. Whereas a lot of these shows, they've got this LED display behind you and it advertises stuff and it's colorful and it kind of makes you look like shit as the athlete. So ideally they'll do what Texas does where they've got the LED display that's cool and promotes the sponsors and whatnot until the athletes walk out. And then there's a black square that you're sitting in front of. So the audience that's live and the live feed from home can still see, you know, the name of the show above you and the sponsors on the sides, but directly behind you, it's just black. So you can actually be the correct, you're the focal point and it shows off your physique in its best possible lighting. Some of the shows, they even use an orange background, which if you're like a reddish brown and there's an orange background, you kind of blend into the background. It doesn't look so good. You can't see where your shoulder begins and the background ends. So the whole point is to have contrast of you versus the background. Hi, what's your take on the use of, okay, we're getting way ahead of each other. So in regards to the previous question, Texas, I will probably be 100% for. I may be able to do previous shows or shows before that, like Atlanta and Chicago, but I may not be 100% for it. All right, the next question is, what is your take on the use of calcium D-gluconate on cycle? I honestly don't know anything about it. Sammy G, slowly we rot by obituary or ultras of madness. Motherfucker, ultras of madness every time. Slowly the rot was slow as fuck. I was never a slowly rot fan. In fact, Morbid Angel was one of my first death metal bands. My favorite band in high school, Rapture specifically, and the Covenant album. But Chapel of Ghouls is to this day probably one of the best metal songs of all time. Plus, I mean, let's be real. Trey Azathoth pretty much invented death metal guitar playing, and Pete Sandoval invented death metal drumming. I can see you leaning out, vascularity coming on your chest. Yeah, I mean, I'm normally pretty vascular, but this year it's coming along really nice. I think I put some pictures up on my Instagram of my chest and my rear double bi. I actually have other pictures that look really good too, like my side tricep. you know, because it just depends on that day and what you train that day and what you ate that day and the lighting. So I literally shot pictures in location A, and then I went to location B and shot a video, and I look completely different. I look good in both, but certain poses look better in lighting A, and certain pictures look better in lighting B. All right, DJ, just got your text, but I stopped my stream to come watch you. Oh, that's fucking funny. Well, hey, DJ, after I'm done with this, let's shoot a video and it can go up later this week. I just didn't have any content, so I didn't have anything ready for tomorrow or today. So this is my Monday release, but that's cool. We got celebrities and up in here. Try experimenting with AI features. What are the AI features? Get help writing, organizing tabs, and creating custom themes. Bitch, I don't organize shit. Have you met me? All right. And then look forward to us working together. Can't wait. What weights are you shooting for? What weight am I shooting for? So weight. I was 193 today, but I was 207 in those pictures, and that was 2 days ago. And you're like, how the fuck does that happen? I actually started counting my salt. I think I'm at 42 grams of salt a day, and I drink about 2 to 3 gallons a day. So I think that's why I put on so much water weight throughout the day, and I get really big by the time I go to bed, and then I pee out maybe 11 pounds over the course of the night. I mean, I don't wear a diaper or piss myself. I get up and go to the bathroom, but it's like every hour I'm up and I go to the bathroom. Astragalus for kidneys during cycle. Never used it. No idea. I know that Dante's good about that stuff. Honestly, I know this is going to sound like it's an arrogant thing to say, but hey, it's coming out of my mouth. What do you expect? I've always been healthy, and I always was health conscious ever since I was 8. So I've never had to worry about blood pressure, kidney problems, because I don't do anything dumb. You know, people are like, we use a lot of steroids. It's like, my opinion is if you're healthy, you can get away with a lot of steroids. What I find is the people that just use dumb cycles because that's what everyone else does. Like everyone else is using 1200 test and 1000 EQ. That's what I'll do. And then they don't keep track of anything, or they don't get blood work, but then they take a bunch of over-the-counter supplements. Like, this is for your kidneys, this is for your liver, but they don't actually know how they work. So is that the appropriate thing for that particular thing? It's like, if you just keep your kidneys and your blood pressure healthy, then you won't have to worry about more kidney damage. But I don't know the mechanism of action of Astragalus. I've never used it, and I've never told anyone to use it. And I've never even heard of calcium D glucarate before. We weigh the same, but you look bigger. Wow, that's good. I didn't know you do lives. I didn't do lives, but I'm doing them now. So what I feel like I am a bad kid. So I'm going to look this up. I'm going to look up what this Astragalus shit is. Examine.com. I know you're like, you use examine.com. I pay for it, so I might as well use it. If I want to look something up quick, I mean, these guys do a great job. Even Huberman does it. I mean, he endorses it. I don't know how much they paid him to say that. Astragalus. Anti-inflammatory, cardioprotective, and anti-aging effects. Wow. Does it suck your dick too? Various Astragalus species are an alternative medicine around the world. This page refers to Astragalus member, a popular herb used in traditional Chinese medicine, known as Astragalus or Huangi. That isn't meant to be racist. I just come out sounding that way. But it is also paired to be another herb called, I don't give a fuck about any of this. What is its main benefits? All right. Chronic heart failure, metabolic syndrome, blood lipids, diabetes, kidney disease, neurological disorders, cell lifespan, and cancer. However, the quality of the evidence for these effects in humans is generally low because of variable findings between studies. Poor methodology quality. That's everything in this fucking world. Is everybody does a shitty job doing studies. Dosage information. All right. Let's look at the goods. All right. Well, things it's for. Sinuses, small improvement. Stroke recovery, small improvement. Immunity, moderate improvement. Diuresis, small increase. Kidney function, moderate improvement. Let's look at this study because that's what his question's about. Study details. After a 77-year-old woman was unresponsive to a wide variety of drugs aimed towards treatment of membranous nephropathy, 15 grams of Astragalus daily for 9 months. Symptoms reappeared when ceasing therapy. Briefly prior, so it's one woman who's 77 saw benefits, and that's it. So people are popping this shit, and I've heard about it for all these years because one woman got a benefit out of it who's 77. Well, God, 77-year-old woman with kidney failure represents our population. All right, there's got to be better evidence than that. All right, I've been tuning you guys out for too long. Let me see. All right, hold on. Didn't know you do lives. Haha, you're the best, man. Thank you. What's a sermorelin? I don't know what that is. Usually all the Raylands suck. They're just for people who don't want to use real GH. Your goal is for competing this year. Winning. I plan on winning. Although if I don't win, that's cool too. I mean, I have the opportunity to perfect my peaking. Is a supplement based on D-mannose useful for treating UTI? What the fuck does that have to do with this? Oh, man. Is there anything useful in this thing? Sources, composition, properties, absorption, serum, distribution, metabolism, elimination, longevity, lifespan, cardiovascular, interaction with glucose metabolism, fat, inflammation. I don't think most people give a fuck about this thing. Interaction with cancer meds for kidneys. Is there anything about kidneys? Man. Kidneys. In humans, astrologists have been implicated in reducing the amount of damage done to the kidneys done by shockwave lithotripsy. Okay, a clinical treatment for urinary calculi. The results, however, were confounded with 10 other herbs. Wow, so they're on 11 herbs? And that's a pretty obscure thing. We use shockwaves to break up kidney stones. So therefore, you should start taking this if you're a bodybuilder. As an injection of Astragalus prior to cardiopulmonary bypass surgery can reduce the adverse effects on the kidneys. How? Help with nephritis associated with lupus. How? Diabetic nephropathy. IgA associated in general nephropathy, at least for clinical use of Astragalus, as protective kidney functions during disease states is said to be significant according to one meta-analysis, which agrees with prior consensus on animal studies. At least one case study has been noted that that one case study was that 77-year-old woman we read about. Despite the large body of evidence of Astragalus affecting kidney tissue, many of these studies are conducted with Astragalus injections. Oral doses appear to be effective, but all recorded oral doses are quite high, 500 to 1,000. It's antioxidant, anti-inflammatory effects on 1 gram per kilogram rat dose. All right. Astragalus has been associated with increasing peeing, an oral dose of blah, 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 0.3 grams per kilogram. So that would be 30 grams in a full-size man, 100-kilogram man. That came out as a dick thing to say, but that's how we usually just go by 100 kilograms, and that's 220 pounds. It's arbitrary, but it isn't because that's how the information is given to us. The mechanism is thought to be enhancing the effects of atrial natriuretic peptide on kidney tissue 4 hours after injection. So you pee out better. So Astragalus makes you pee. It's a diuretic. That's what they're trying to say in a really fucked up way. DJ, Garrett and I am sitting here rolling. Please do lives more. What's up, Garrett? Miss you, man. I was thinking about you today. Scott Rizzardi, for 50-year-old bodybuilders, advanced, do you recommend backing off on the days per week of training? Does the age matter? So we're not all the same, right? Over time, age can be destructive if you live a destructive lifestyle, or it can be constructive if you live a constructive lifestyle. So what the assumption is that people get worse as they get older, but that's because your average person is a couch potato. I think bodybuilders get better at certain things. However, your recovery may not be as good. So if you have overlapping soreness, like if you do chest on Monday and then you're still sore Thursday, don't do chest again on Thursday. Even if you used to be able to do chest Monday, Wednesday, Friday, and now you have to do Monday, Thursday, and eventually you might have to go Monday, Friday. It's just you have to listen to your body. Another way of doing it is just reduce the volume and you can keep the frequency the same, because in the end, it's the amount of volume per week. And you want to have as many exposures as possible because the first set and the second set are the best 2 sets. So in theory, rather than doing 6 sets on Monday, if you did 2 sets Monday, 2 sets Wednesday, 2 sets Friday, you got 3 first sets and 3 second sets, which is going to be better performance than if you got 6 sets on Monday because you only got 1 first set, 1 second set, then you got a third set, a fourth set, fifth set, sixth set, which aren't going to be as good. Masteron feels fine. I don't notice anything at all on Masteron. Masteron's fine. For the record, it'd be very difficult for me to explain the entire course of the last 3-year off season as to how I was using stuff. But as of this prep, when I started this prep, I was on 840 test, 140 primo. That gives me exactly 100 estradiol. And I was making up the difference with Masteron to hit a total of 3.5 grams, which I believe is 840 test would be 120 a day, then 20 a day of primo. So it'd be 360 a day of mast. And then I wanted to lower my estrogen because I was holding a lot of fat on my glutes and lower back and hamstrings. So the prep is the presumption was I talked to a bunch of people and they all were like, Todd, you're really carrying too much water in these locations and or fat. You should probably bring your estrogen down. And the reason why I was leaving it in is because estrogen is supposed to, of course, have benefits like cardio protection, neural protection, hair protection. It basically cancels out most of the androgenic side effects, having a balance with estrogen. The HDL is benefited from the estradiol. The estradiol converts GH to IGF-1 and all that stuff. It's extremely good for you. But if it is going to bind, and somehow it locks the fat into the female-dependent fat locations. So the whole point of him being a rauwaucine is to unlock through the alpha-2 receptor the glute fat, the lower back fat. And that's not entirely true, but the glute fat and the back of the thighs. So for me to get the hamstrings and the glute cuts, then rather than using as much yohimbine and rauwaucine, which I hadn't used yet, I could just reduce my estrogen. My goal was to reduce it to 40. So I did a short-term thing, which I don't recommend anyone doing because it's kind of advanced. I brought my test down to 40 a day, from 120 to 40 a day. But to speed up the process, I jacked my primo up from 20 a day to 100 a day. Meanwhile, I was taking it out of the Masteron. So I never went lower or higher than 500 milligrams total a day. It's just that I use Masteron as a neutral anabolic because in me, it's neither androgenic nor estrogenic nor anti-estrogenic. It's just a neutral anabolic in me. It's what people say Primo does. That's what Masteron does in me. I keep having to say this because people have very, very bad memories and they can't seem to grasp this. And then I used that to crush my estrogen. And the day I was feeling really dry and my elbow started hurting, that's when I took those pictures, and those pictures are up on my Instagram. And then since then, I backed off on the Primo to 60 a day. And I went and got blood work done today. And I'm going to get I got my estradiol and my T3 tested today to make sure they're where I want them, because ideally I'd like my estrogen to be between 20 and 30. And that's not because it's what's best for anabolism. It's not what's best for health. It's so that I can get the fat off of my ass, because that's the only place where there's any fat left, which means that my estrogen was too high for too long. That doesn't mean I don't endorse it being high enough to get the most IGF-1 conversion, assuming you have no side effects in the off season. It just means that pre-contest, if you want to get the fat off of your ass, you should bring your estrogen down to about 40 or maybe lower, assuming you're not so dry that it affects your training. All right, let's see. What did I say here? Why do AAs cause lower back pumps? Because they cause water retention. It's not all AAS. It's Masteron does not. Most of the DHT derivatives do not. Anadrol does, and testosterone do. And basically, I believe the reason is because they drive up aldosterone. And the way that they drive up aldosterone sodium retention is through, they deactivate the 11-beta hydroxylase enzyme, which is part of the glucocorticoid pathway. So there's a shunting of the glucocorticoid pathway to the mineralocorticoid pathway. So not every, but in theory, some of the molecules that are supposed to go, I think from pregnenolone over through a pathway down to make cortisol, ends up as aldosterone. And so there's certain drugs which make you fuller, and those fuller drugs are generally either stuff that converts to estrogen, like Test, or stuff that 11-beta hydroxylase deficiency, like Anadrol and Test. Which is probably why a lot of people think that you grow better on Test, is because you're holding way more water, and because estrogen's anabolic. How do you feel on high and hardening Masteron and feel? Yeah, so there should be no hardening on Masteron. I think that's a myth, unless in you Masteron is an AI. Why do AAs cause lower back pumps? Just explain that. P5P protocol for lowering prolactin. I don't know what that is. First time using 19 nor, 120 milligrams Tren E a week. Lost libido on week after starting Tren E. So stop using Tren E. Tren E's garbage unless, yeah, I mean, for cutting for a bodybuilding show, the last couple of weeks you use Tren Ace. There's no other appropriate time to use Tren Ace. How far from a show should I cut GH out if I'm holding water from it? You should use GH that doesn't make you hold water. Only bad GH and Serostim makes you hold water. All the other good GH brands have Mannitol in it, which you shouldn't hold water on it. But the simple answer is you probably, prior to it being too late, pull it out. And once you look as dry as you're going to get, and let's say it takes 5 days, then you know next time pull it out 5 days early. Yes, I noticed with others picking apart your thoughts on how to run a cycle, which is funny because I don't think any of those people actually compete. Face looking lean as fuck. Thank you. I like your deep thought and exploration on cycles. Thank you. Glad you explained the high estrogen, explained the water retention. I noticed my midsection and lower back. Yeah, I mean, to me, if you're holding water on the gear you're on, that means you're using the wrong gear and or your estrogen is too high for you. See, I don't hold water. I mean, I'm willing to hold water in the off season, and I don't even mind holding water up until the show. But here's the thing: if you can't see how lean you are because you're holding in so much water from either estrogen or aldosterone, then it's shooting yourself in the foot. That's why I think it's appropriate 8 weeks out or whatever. Some people like to say, leave your test high, like 700, and then throw in an AI to control the estrogen. That doesn't account for the aldosterone. And you're basically just unnecessarily keeping your DHT high. So to me, the more logical thing is 7 or 8 weeks out, bring your testosterone to like 30 or 40 milligrams a day. And then your estrogen should be about 40 and your DHT should be about 60, 65. And you really won't be holding much water from that HRT or super HRT dose of testosterone, and you rely on appropriate drugs like Masteron and or Primo and or Winstrol and or Anavar and or Tren to finish the job of getting in shape. Because once you're within 8 weeks of a show, forget about building muscle. You'll want to retain muscle, but you want to be dry enough to where you can see what's going on, but not so dry that your joints hurt. A lot of people say Winstrol makes my joints hurt. It's like, does it really Winstrol that's making your joints hurt? Or is it the lack of cortisol and or that you also are running an AI and crushing your estrogen? Because remember, it's water balance. It's not like being dry is good. Being dry is different. You can't, people are like, oh, I want to take this for fullness and this to be dry. It's like fullness and dryness are contraindicated. Like they're opposite ends of the same spectrum, that if you take something to make you fuller, you're going to be wetter. That's why you're full. They don't say wet and dry. They say full and dry as this two ends of the spectrum, like male and female. Like you can't get more female and more male at the same time. You can't get more dry and more full at the same time. I mean, you can. The water can transfer from subcutaneous to intramuscular, but that's true reduction of estrogen. Estrogen makes the water go sub-Q. Salt makes the water go sub-Q, whereas aldosterone makes you hold salt, which means you hold total body water. The 11-beta hydroxylase deficiency will make you hold salt. That makes you hold water. The diuretics make you flush out salt, which makes you get rid of water. That the way that Winstrol works is a cortisol way, which is a different mechanism. But in the end, we want estrogen to be as low as possible. We want to be as low body fat as possible for the stage this is. And this is not for anyone but competitive bodybuilders on stage. And it's pretty much only the day of the show. You want your estrogen as low as possible. You want your sodium to be appropriate so that you have vascularity, which is a big if. And if you're running testosterone or bad GH, you're going to hold water through aldosterone, which means there will be some subcutaneous water, which means you won't be dry. So to be as dry as possible, you want to have zero test, zero estrogen, zero GH, bad GH. There's certain GH brands that don't cause this, like mitotropin. Metotropin doesn't do it, and genotropin doesn't do it. In fact, genotropin works as a diuretic in me. And then supposedly Winstrol will make you super dry. The other thing is Anadrol works through the same mechanism, but it works really fast. So if you're too flat, then instead of, you can't inject test and have that kick in anytime soon, but you can take Anadrol. So swallowing Anadrol will do the same thing for fullness that test will. Same thing with GH. GH will not kick in fast enough. The only thing that'll kick in within hours if you're super flat is water, carbs, salt, and Anadrol. All right, I'm due for bloods. Yeah, Twisted. I honestly don't know who you are. I know who you are in real life. I just don't know who you are based on that handle. Let's see, Nick P. Are there any things that can be unintentionally lower free test? Asking due to mind continuously coming back in the single digits. SHBG. I mean, I don't know what your total test is, but for the most part, free test doesn't really matter. It's your total test that matters. A lot of people are hung up on free test. I don't know why that is. What's the current list of shows you have planned? Any changes? So the current list is, if I'm ready on time, Atlanta, and then Chicago. Atlanta won't interfere with Chicago. Chicago won't. Atlanta could interfere with Chicago, but Chicago won't interfere with Atlanta. Then Texas. I don't think I can do Tampa and Texas because Tampa's too close to Texas and would interfere with it because it's first. And then there's Masters World Championship, September 1st. And then if Roman comes to town to do a show on September 7th, I'll do it with him, even though I'm not the right weight class. It'll just be fun to do a show with Roman. And then I was looking at Japan, China, or India for the winner, but I'm probably going to use the winner to get bigger because I'm not very big. All right. Adding HETZ to 80 milligrams Telmisartan for lowering water retention. Thoughts? Will have any kidney problems? Chase Iron's running it with Telmisartan as well. I mean, the reason why you'd have kidney problems is because you're dehydrated and your blood pressure would go up too high. So the way that you're looking at the question means you don't really understand physiology, and you shouldn't be treating yourself for medical illnesses. You should have a doctor do your health care. And Chase is a smart dude, and Chase is smart enough to do himself safely and healthily. And I trust Chase to give me good advice, but I don't know that everyone watching Chase's channel understands the nuances, because like your question means you don't understand why a diuretic would cause kidney problems. It just sounds like it's magic to you. And if you don't understand physiology, you shouldn't be dabbling in pharmacology. Have you ever tried running Proviron up like Masteron? I'm currently experiencing with 100 milligrams. I see absolutely no point to Proviron. It's retarded. That Proviron's whole point is that you're not man enough to use Masteron. And let me give you a better explanation, because that's apparently pedantic. So Proviron cannot bind to the androgen receptor in the cytosol without getting broken down by 3-alpha HSD. So it can never grow muscle. It's just vastly inferior in every way to Masteron. There's no reason to ever run Proviron unless the purpose of the Proviron is to block the 3-alpha HSD so that the Masteron can sneak past it and not get chewed up before it binds to the cytosolic androgen receptor for genomic expression. But you're using an expensive drug to protect a cheap drug. Why not just run the cheap drug more? Like, it doesn't make any sense at all. Rather than spending the money on 100 milligrams of Proviron, you could just run 100 more Masteron. There's no rational thought whatsoever to ever using Proviron. And that's assuming it was injectable. But this bullshit's oral, which means that if it is 17 alkylated, and I don't know if it is or not, 17 methylated, and I don't know that it is, but if it was 17 methylated, it would do kidney damage, liver damage, and it would work like shit. Both of them bind very strongly to SHBG, so that special property is irrelevant. Furthermore, if you've ever ran testosterone over like 2 milligrams, you're going to have a really, really low SHBG. Plus, we don't necessarily want to wipe out SHBG because SHBG has its own binding sites. And according to Ryan Root and Austin, who is a really smart kid, even though he's not officially educated. He does know his shit. Both of them swear by the anabolic effects of SHBG. I'm due for bloods. Okay, should you take oral ancillaries like Cialis, Aromacin, etc., sublingual to avoid liver stress? I don't know that they are liverally stressful, but I do agree with the concept of doing everything sublingual. Remember, like, the best mechanism of delivery is injection. IV is the fastest, but it's also the most dangerous. Intramuscular is the better choice. Sub-Q is a step down from intramuscular. There's almost never a situation where sub-Q is better than intramuscular. Sublingual is the step down from subcutaneous. And then oral is the worst way. Like, oral is the worst way to deliver a drug ever. It's just the dumbest fucking way. The reason why there's any drugs that are available orally is that really, really dumb people are so incompetent. Other than sticking things in their mouth, they can't do anything. And that's why. Otherwise, every drug, if you had a planet full of Vulcans, like if you had the planet Vulcan, I bet you Spock and all his family, they inject all their medication. They don't swallow shit because they're smart enough to use a fucking needle. And that's it. All right. Serostim doesn't have mannitol in it. Correct. Oh boy. Serostim doesn't have mannitol in it, I believe. So why now water retention? It will. Okay, that's your. No, I must have either misspoke. You must understand me. Serostim doesn't have mannitol in it, so it does have water retention. It's the only pharmaceutical brand I know of that doesn't have mannitol in it. So all of these people are running to Serostim because they think it's better than everything else. The reason why they think it's better is because they instantly get fuller on it because they're retaining water. That's it. That it just makes, they all say the same thing, like, dude, I was full as fuck on it. It's like, you're full as fuck because you're retaining water because it makes you bloated tick. The other stuff, they put mannitol in it to protect people from getting the carpal tunnel side effects. And the reason why they can run higher doses of other things is because there isn't the carpal tunnel, because it's not making them retain water. People get the carpal tunnel and they think, oh, because I'm full and I've got carpal tunnel, Serostim works better. When they understand that what they're looking at is the side effect of not having the mannitol that all the other brands have it in there. Remember that Serostim specifically for AIDS patients. AIDS patients are usually rail thin, so them holding water isn't a big deal. Pregnant chicks get carpal tunnel because they're retaining water because of all the progesterone and estrogen that they've got in their body. Some obstetrician is going to get mad at me because I said there's estrogen in pregnant chicks when it's really just progesterone. And honestly, I don't remember the exact phases as to what point, like weeks 1 through 3 and 7 through 10 and 32 through 33. I don't remember what the amounts of estrogen and progesterone is. Point is, both of them work through homology to aldosterone at the kidneys, water retention, and therefore that's why they get carpal tunnel. All right, running EQ into cut. Really big fan personally. Feeling amazing and growing into a show literally on it. But I'm having crazy MK677 hunger on EQ. Any way to counter the hunger increase? So this is something nobody does, is they don't look at this logically. I'm glad you do. That EQ is basically a lot like Primo. Is that it causes increased red blood cells. It has a special property of increasing collagen synthesis. It causes, doesn't cause the liver damage of Primo, but they're both AIs. So people compare EQ. You notice the pros run like a 1200 test and 1000 EQ, or they run 1200 test and 1000 Primo. And that's because that gives them a 50 or a 40 estradiol, because of the EQ and the Primo are AIs, which counteract the enormous amount of estrogen that the test being that high would create. And that rather than doing something a little bit brighter, like running a neutral compound at 2 grams and running 200 milligrams to test, their whole rationale is everyone does it this way and they're bigger than you, so I'm going to do it this way, which is valid and it works. But what they never realize is that just because EQ is good in the off season, like Primo, doesn't mean that Primo and EQ aren't good in the contest phase. That running Primo or EQ in a contest phase makes total sense. That EQ is the, I don't want to say it's a myth, but there is this belief that EQ causes hunger, and you're experiencing it. So what I would say is to combat hunger, metformin is supposed to combat hunger. Also, melanotan combats hunger, and so does Ozempic, although Ozempics might have permanent disfiguring side effects. Let's see. Can you just up your AI or lower your estrogen? Or is it better to lower your test before show? Okay, so all right, have you noticed extra fat gain from Telmisartan because of your PPR activation? I don't know what that is, man. All right. That I use 40 milligrams of Telmisartan, and I mean, it was probably the most irrelevant drug on the history of the planet Earth. That if I was to smell a cupcake, it would probably have a bigger impact on my body fat production than any Telmisartan. Best type of rice, jasmine rice is the best type. If you want to build muscle, because it's got 110 glycemic index. Basmati rice is the best if you want to cut, because it's got 55 glycemic index. Why isn't there any injectable form of Anavar? Probably because someone would have to crush up the pill and then dissolve it in water. And then water breeds bacteria very quickly. Is it a myth or fact? Pinning the muscle directly allows for better growth of that muscle. I move my location around and give sites a break. I think it does, although what they'll say is that's not how it works. It goes from the bolus of oil you've generated into the bloodstream, and then in the bloodstream, the capillaries have enzymes on the inside of the capillaries that breaks off the tail off of carbon-17, the alkyl tail, and then now you have an active hormone, and it goes wherever the bloodstream takes it. What these brain trusts haven't considered is that if you inject your tricep and then go do tricep pushdowns, yes, the blood is going through the tricep, it's taking the steroids to your heart, but where does it go from your heart? It goes to where you're getting the pump. That by doing exercise with the triceps, you're releasing nitric oxide, dilating those vessels, and through the concept of vacuum, that more blood is going to shunt towards where you're training than other tissue types. So you're correct. If you inject your tricep, it's not going to stay in your tricep. It's going to go in your bloodstream. But the bloodstream carries it right back to the tricep, which is the working body part. So, and then you're like, well, why couldn't you do your quad? It's like, you could do your quad. You could inject your quad. But because you're not pumping your quad, there's not as much blood going to the quad to drag it out of the quad, put it into the bloodstream, and bring it to the tricep. That's why you should probably inject the body part you're training that day. And most people do that with Tren acetate or with test suspension. The other drugs won't kick in fast enough. For that, I would use sublingual Anavar, because sublingual Anavar will hit faster than anything else. Injectable Anavar, how is that something I never heard of? Not being sarcastic, because it doesn't exist. That's why you haven't heard of it. So why is the blue tops toss in some Lasix? So when using blue tops, no, I don't know what you're talking about. Don't use blue tops. Use real GH or a brand that has HPLC testing by Janosic or something showing that it's real, 191 GH, and never use Lasix. That's a stupid drug to use. Which test? I mean, let me give you a better answer. I think that the best is just hydrochlorothiazide. And that's like for competitive bodybuilding, like it's just a foolish thing to think that just because I'm using GH, I have to take it out. Just like people who use Caber just because they're using Nandrolone. The idea that you're going to use a prophylactic drug just because without looking at your blood work first is retarded. Just like I was saying that only idiots would take an aromatase inhibitor to cover up too much testosterone. You should take just enough testosterone to get the estrogen you want and then rely on other drugs that are neither a substrate for testosterone nor an aromatase inhibitor to fill in the rest of your anabolic load needs. Hey, Todd, hey, what's up? Cuckolding Strength and Fitness. I thought you were blocked. You must have made a new account. All right. Matt, have you read all of the Legend of Drizzt books? Best D&D characters, hands down. Off topic, I know. I haven't read all of them, but Menzoberranzan is my favorite setting. Menzoberranzan is my favorite setting. And Drizzt is a cool character, but he's so popular. Generally, when things are popular, I don't like them. But yeah, 2 scimitars, it makes sense because he's using 2 weapons and because he's a finesse fighter. which test retains the most water, an anther sip? It doesn't matter. I get iron deficiency without anemia. What? From running EQ. How big of a deal is that? Just take more iron. Because the reason why you have iron deficiency is because all your iron is being used to make red blood cells. And an iron supplement's not going to actually add iron. You only absorb 5% of that. You need to eat red meat, and you get 30% absorption of iron from red meat because it's already in the heme molecule, so it's easier to absorb that way. Do you have a process for rehabbing shoulder impingement clicking? Use less weight, do more reps, see a massage therapist, possibly a physical therapist. Hate people saying that EQ is anxiety and worse compound. I actually mood elevation euphoria and positive effects on it. Do you think it's not a myth? It's from Crush G2, like you said. It's front loading it and Crush G2. Matt, the latest comment was Blue Tops was sarcastic. Oh, thanks for explaining that, dude. You got to remember, if you don't put LOL, then I don't know you're kidding. And you got to remember, other people read these. And if you read some of these other questions, not everyone is super sophisticated or they're new to this game. So they might take your question seriously. From your experience, when does EQ reach maximum E2 reducing effects? Technically, it reaches full concentration almost 90 days. So I really looked at this, and I don't know how that was typed in, because I went back and I did it myself and I made sure to make it daily injections like I do everything else, and it hit steady state concentration in 23 days, the same as Primo. So with EQ, if you do daily injections, you hit steady state concentration very quickly. I think that whoever typed that in was doing twice a week injections, which is absurd. No one should ever do twice a week injections. Every day is the only way. And I know you're not supposed to give definitive statements. You're supposed to be wishy-washy. Well, on this channel, I give definitive statements because I want people to learn. I don't want to just play it cool and fit in with the cool kids and give wishy-washy answers. That you should do every shot every day. What are the side effects of low SHBG? I don't know. Yeah, I don't know what the side effects are of SHBG. How long do you plan on staying gearing up for the living this lifestyle? I don't understand what that means. Spiral BJJ. Sup, Todd? Have you seen the show Devs? No. What is it about? Developers? I don't know. I've had a 2 SHBG for the last 4 or 5 years. I've never noticed low libido. And I don't think anybody who uses steroids has a SHBG in the double digits. And so back to Twisted Titanium's question. How long do you plan on staying gearing up and living this lifestyle? I don't know. I guess I wouldn't use anabolics beyond HRT if I wasn't competing. So as long as I compete, I plan on using gear. I plan on competing as long as I can because I don't really know anything else. Do you implement baby aspirin on EQ? I don't know why you would. What's the point of that? Isn't that just it destroys your platelets? Why would you want to do that? This is so stupid. They're like preventing heart attack or stroke. Yeah, motherfucker, how? It's considered a type of blood thinner, although it doesn't actually thin your blood, right? It's antiplatelets, make it harder for blood to clot to form. It means you bleed. Yeah, so it's like, yeah, in theory, you'll have less clotting. Not that you would have clotting, but in theory, you'd have less clotting, but you have the very real risk of bleeding to death. So I don't know, man. I don't think it's worth it. That seems dumb to me. I certainly wouldn't take if I had to take a drug, the side effect of a drug, I wouldn't take the fucking drug in the first place. That's just dumb. Just take the drugs that have no side effects like Masteron. Let's see. Spiral BJJ took something back. Okay. And I know everyone's like, well, you're the only one who feels that way about Masteron. It's like, working a lot of people, and I've never seen Masteron be an AI. It's just a myth as far as I'm concerned. Although people swear by it, even the one person who said that for sure it wasn't him, he rolled it back when I talked to him about it a little bit later and said he was on other drugs too. So he isn't 100% sure it was that drug. I don't want to give it away, but hard sci-fi cooperative espionage. Oh, I like sci-fi and espionage. It's called Devs. Okay. Let's look this up here. Devs. All right. Devs. All right. What is it? What is it on? Hulu? Season 1. Looks like I have to buy it. Oh well. I'll figure it out. It's got to be on something. I've got like 8 different things. Blood thinning effects. Yeah, I know blood thinning, but blood thinning is baby talk. Fish oil thins blood a bit. Yep. Not really, though. Not like significantly. That's going to make a difference. But the thing is, thinning your blood is different than destroying the platelets' ability to form clots. Nattokinase does the same thing as aspirin. Byron, yes, it does. Who's Byron? Brian. Oh. Okay, he's answering him. Annie the Boys fans in here. Season 4 is in. Oh, really? I love that show. I like Homelander the most. That's my favorite guy. All right. What stats would you need? I see they get this fucking heart bullshit. So I can but I can't read what you say. So fuck. Some need at 6. I don't know if that says 6'11". Probably not. 6'1", considering competing in open. Well, it depends. Are you talking about bodybuilding? Yes, you say open, but I hate when people say open because that implies that you're already an IFBB pro. So you wouldn't be asking that question if you're an IFBB pro. So if you mean there's bodybuilding and there's classic. So there's no such thing as open in the NPC or the amateurs. In IFBB, there's classic, 212, and open. There is no open in amateur level. It's called bodybuilding. So could you be a bodybuilder at 6'1" at a state level? Yeah, you'd have to be at least 240, 250 on stage to be like competitive enough to turn pro, if that's what you're asking. And then as a pro, if you're 6'1", you'd have to be at least 300 pounds. And I know a lot of people are like, that's not true. And blah, 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 blah. It's like, look, man. He asked me, that's my opinion. It doesn't make it a fact. It doesn't make it true. It's just what I think. If you don't like my opinion, that's okay. You don't have to like my opinion. You can have your own opinion, but that's my opinion. That's it. Now, I'm sure some people might give an example like, this guy is 250 and this guy's 260. I'm like, that's true. However, if you look at all the successful guys who are over 6 feet tall, they're about 300 pounds. There's Crizzo. There's, what do you call it? Samson. There's Andrew Jacked. There's not a lot of guys that are 6'1" as an open bodybuilder, and they're all about 300 pounds. We got 52 people watching. That's cool. 21 likes. And the mic's quiet as fuck. What's this button do? Share screen. Oh, we can share our screen on this? Oh, fuck. Let me try it. Select tab here. Window. No, I don't want to do that. Entire screen. No, I don't want to do that. All right. Cancel. Well, at least I know for next time I can use this app and share my screen directly, and then have show like my push the button and show my blood, my fuck, what am I trying to say? Spreadsheets. I can do spreadsheet sharing and stuff. See, what's fucked up is I use my phone for everything. I don't use my computer for anything other than filming this stuff. So none of my shit is on my computer. It's all on my phone. And I know what you're thinking, like, well, you can share it. It's like, well, if it was a Chromebook, it would be easy. Or if it was an iPhone and whatever those are called, iBooks, iMacs, then I'd probably be easy to share shit that way too. But since this is a Windows computer and a Google phone, they do not work well together. Matt, I've just came to accept that my bodybuilding aspirations need to be limited. You don't have to be. That's not true. You could have classic physique aspirations that chicks dig tall people, and classic physique is for the girls. And for guys, I guess too, because it is Pride Month. And there's even straight guys who like classic. But the point I'm trying to make is that there is a place for you in the ranks of classic, and being 6'2" would be a very beneficial thing. I think you could be 225 is the cutoff for classic at a state level, and I think 240 is the classic cutoff at the pro level at 6'1.1 to 6'1.2. Are you okay? Off topic, Trump or Biden the loser? Well, that's a quick way to get your channel canceled, is to say something positive about Trump. I don't know, man. I'm not going to talk about Trump and Biden on the channel just because I don't need to lose everything I've worked so hard for. Let's just say that I bet within 11 months, I'll be able to have this conversation. Not 11 months. In 6 months, I'll probably be able to have the conversation. Is it safe to weight train with AFib? Yeah, I don't understand why everyone's so freaked out about AFib. I think that other doctors just use AFib as an excuse to put you on beta blockers so they can make money off you. Because most of the way that they diagnose AFib is bullshit. Like, you had an arrhythmia one time once, and so forever after you're labeled as AFib, and then they've got an excuse to give you warfarin. I mean, I've got at least guys who have AFib that are lifted just fine. You stream your phone? I could never. No, I'm not streaming from my phone. I do everything else from my phone. Yeah, I don't use my phone's fucking awesome, except for it's difficult. Yes, sir. Matt, men's physique is strictly for gay dudes. I didn't say that. I said that classic. In fact, I said the polar opposite of that. I said classic physique is popular with ladies and with dudes and with straight dudes, I think is what I said. So I didn't talk about men's physique at all. And I certainly didn't use the word gay. And I used, anyway, I'm not even going to bother dignifying that with a response anymore. Haha, that was funny. Pride Month. Yeah, man. Hey, Dr. Todd, just saw your recent pics. Chest looking great. Very cool vascularity as well. How many weekly sets for chest during your off season? Okay, so off season chest this year, I did 6 sets of pressing, 3 sets of flies twice a week. So for 18 sets of chest per week, because chest is one of my best body parts and I don't really care. I just want to maintain it. I'm only doing 4 sets of pressing twice a week. So I went from 18 sets in the off season to 8 sets pre-contest. I reduced volume on virtually nothing else. I went from 28 sets of lats down to now I'm at 12 sets of lats. And I went from 18 sets of chest down to like 8 sets of chest, but everything else is the same. Triceps, biceps, delts, legs, quads, hams, everything, upper back, they're all the same. I just, I wanted to keep the volume high for the things that I needed more of, and the things I didn't really need, I just took it down. And I also had been running a 1-year block for lats, and it didn't really work. So it was like I'm throwing half the volume of the week at lats. They aren't growing, so they're sure as fuck not going to grow in a deficit. So I just said fuck it and brought them down to what I thought was minimal effective volume. DJ, I hate your phone. You can't FaceTime. I can FaceTime, use Instagram or use WhatsApp or use any other fucking app. Just don't use what's it called? the iPhone feature. Like, it's so weird that the iPhone people don't know that you can FaceTime on every other app. Just the Androids can't FaceTime with iPhones. Why they do it that way, I don't know. And don't get me wrong, I am going to buy an iPhone as soon as I get around to it. And honestly, why even ask the Biden-Trump question? We're alpha yoked fucks there. Ain't nobody pro pedo Joe in here. Just saying. It's like, yeah. You never know. It's like, I don't know, man. Twisted Titanium. I like how Todd answered the political question. A little true. Could be some SARMs guys in here. Dude, there's so much shit that Paul has convinced me not to say on the internet that I'm so much more fun when I'm not on YouTube. It's like, I probably one day I'll do a live Instagram and I'll just let her rip. But on YouTube specifically, I don't want to say anything that's going to trigger the them. All right. Dr. Todd, you and MT2 looking dark. Yes. Yes, I am. I'm going for, I identify as a person of color now. And in order to achieve this transition, I'm using MT2. Can I say that? I'm pro-trans. I'm transitioning my color. Thank you, doctor. As you are back training, would you change vertical concentration or horizontal growing the lats? So, okay, so I feel that lats are exclusively vertical. Let me rephrase that. If you want to train your lats, do vertical. Yes, there are horizontal things that train the lats, but what fibers? When people say that they need lats, what they really mean is that they need the sacral and lumbar originating fibers of the lats. They're not really saying they need thoracic originating fibers of the lats. So the horizontal lat exercises, even if your arm's close to your body, you're working mostly your upper lats or the thoracic originating fibers of your lats. Most people, when they want lats, they want lower lats. So you want lumbar, which is like this, or sacral. I mean, is it sacral or it's iliac crust originating? Anyway, Kassam has tons of videos about this shit. Joe Bennett talks about it. John Jewett talks about it. Hunter Labrada talks about it. They all have great lats. I do not. So even though I can repeat to you the things that they say, I lack credibility because my lats. All right. All right, because we have droids, man. They don't like us being able to do shit with our channels because Google owns YouTube, correct? And competes with Apple. Right. Okay, that makes sense. It won't even let Apple users join my memberships. Oh, I didn't realize that. So YouTube, so droids are an advantage for using YouTube over Apple, but Apple's probably an advantage for using like TikTok. But I don't know if that's true. It's just my supposition. I believe our goals here is to get as big as fuck, but have to realize that we can be. No, man, realistic. Being realistic about your goals is basically just accepting defeat. Don't be realistic. Just dream and keep trying until you succeed. It wouldn't be realistic for someone to be a medical doctor and a pro bodybuilder, but I did it. I have two different vials of HGH. One is 10, other is 24, but both seem to have the same amount of powder. Should the 24 IU vial have double the amount of powder? Yes. No, probably not filler. It's just I don't really trust either of your sources because no real GH is made in either 10 IU or 24 IU amounts because 1 milligram is 3 IU. I use kind of like idiot baby talk we use that in this bodybuilding space, but really a 3 milligrams at 99% pure is going to be half as much or less than half as much as 8 milligrams at 99% pure. So there's no way they could be the same. It's impossible. Anything for shoulder impingements? I answered the last guy's question. You probably missed it. Just decrease your load, increase your reps, use perfect form. If some exercise hurts, don't do it. Get a massage, go to a massage therapist, and maybe try BPC 157 or TB 500. Best test for EQ ratio, Tren E 120, also in picture. I don't like, dude, on this the whole time. We've talked about the test and EQ the whole time. I think I told you specifically Tren is stupid, and to use Tren Ace before a show and only before a show, and it's not, and Tren isn't good for anything else. Any good exercises for shoulder impingement? Didn't you just ask that? All right, Stefan Artuni, thank you, doctor. You have all the credibility, brother. I have gained so much in the past 2 years listening to you, Paul, Kurt, and Skip. You're welcome. Run half EQ to test, in my opinion. That's what I do. Constitutional psychiatrist. Dr. Todd Lee's animal language. You're right. It's 100% true. I asked Google support why iPhone users don't see the join option. We're working toward it. Interesting. What are your best lifts in your training career? If you check out my Instagram and scroll back about a year or so, you'll see am I going slow or am I going fast? If we want to just talk raw numbers and I'm going with total control, but it's not to a certain tempo, then I would say 455 in a Smith squat for 9, deep as fuck, slow as fuck with a pause. For bent row, my best ever is 435 for I think 6 in a Smith. For incline bench in a Smith, I think it was 335 for 7 or 8. It was like 7 plus 2 partials. Definitely, you never use orals. Is that correct? I use orals in contest prep. I'll use Anavar to kind of force strength if I'm losing performance in a cut. Also, I plan on using either Winstrol to be drier for the stage if I'm wet, or using Anadrol to be full for the stage if I'm flat. I might use both, although it's technically illogical. They work in different mechanisms. That the Anadrol is supposed to drive fluid into the tissue, and the Winstrol is supposed to prevent cortisol and pull water out from under the skin through a different mechanism, and neither of which are working through the estrogen-mediated pathway. So in theory, it's the one time where you could use the push and the pull at the same time and get complementary effects, is stacking the Anadrol with the Winstrol. Although I've never tried that before, so it's just a guess. That's part of why I'm doing so many shows this year, is so I can try out a bunch of this shit. And I'll have a cameraman with me most likely, and so you'll get to experience it with me as I go through the process, and we'll learn together. What, never use orals? Yeah, okay. Stack that TB and BPC Pro. Graston therapy is something heart fire as fuck to all of it kept me off the table. So I'm going to translate. So stacking TB 500 with BPC 157 with Graston as a combination, preventing him from needing surgery. I think that's what constitutional stacker is trying to say. Do you have any old school favorite bodybuilders that inspired you? I like Lee Priest a lot, both on and off the stage. I think his personality is perfect for me. Also, I like Dorian's approach. He is a true scientist because he experiments on himself. He's not like, well, it says in this rat study this, so it must be true. He like tries it on himself and sees if it works for him. So Dorian, and that, I like how Arnold approached the business side of it. I liked Arnold's showmanship and charisma. I like Serge Nubray's presentation. I like Frank Zane's scientific approach to gear and how shredded he is. I have a special place in my heart for Franco because we're kind of built the same, about the same height, same weight, same body type. Crazy bat comes common with HGH. Nope. Recovering from a torn pec with 4 IU a day, and now I'm almost crippled after you're walking outside. It's probably just using shit GH that doesn't have any good excipients in it to take care of that water retention side effect. Metotropin is no water retention. Also, if you switch to genotropin, you'd probably feel drier on it. Also, I think the one in the brown and yellow box, I forgot which brand that is, but the only one that actually causes water retention that I know of is Serostim. That's why people think it makes them, that's why people think Serostim's better, is because they feel full on it because they're just retaining water. That doesn't mean it work. It's still really good quality GH Serostim. It's just that's why I think people think it's better than everything else. It's just like how they think test makes them grow. It's because they're retaining water on test. 55 watching and only 29 likes. Don't be the beta simp, smash it. Yeah, this guy's cool. Well, now it's up to 32 likes, so people heard you. Orange Diamond, a lot of bro science says using tamoxifen with trenbolone will cause worse gyno. Huh, that doesn't make any sense to me. It doesn't make any sense to me either, bro. That tamoxifen is a prodrug. It converts into several metabolites, some of them not for 60 days, but two of the metabolites, one is an estrogen alpha receptor blocker, and one of them is an aromatase inhibitor. There's no rational explanation why that would cause gyno, especially if you're taking trenbolone. Now, trenbolone is a progesterone receptor agonist, which would downregulate the estrogen receptor alpha, which means in theory, if you're running too much tamoxifen, there might be free tamoxifen floating around and it binds somewhere else. But my understanding is tamoxifen binds positively to the estrogen receptor beta, which would stimulate, which would compete with gyno, not stimulate gyno. So I don't understand where you heard that from. Have you heard multiple people say this? And do they have all their teeth? Because that sounds like the dumbest shit. Do you ever see that show Breaking Bad? That sounds like something Jesse Pinkman would say about meth. Is somebody's that sophistication level that would say that the tamoxifen plus trenbolone causes worse gyno. Now watch, it's someone really smart like Scott Stevens or Dean St. Mart, and then I'll be eating it. But I really cannot come up with any mechanism that would be true. Jacob Haas. Thanks, man. Found your channel about a month ago. Great info, and definitely no BS. I try to tell the truth. Doesn't mean I'm always right, but I'm definitely not bullshitting anyone. Added a like. Thank you. Also, liver enzymes are in range. Okay. Yeah, I still don't see a point to Tren E. I mean, just if you have gyno, you're not using enough EQ or you're running too much test. Like that's the simplest way to tell. And then if your blood pressure is not high and you're not fat, keep doing it. Would you have Lee Priest on the show? Of course, I'd have Lee Priest on the show. I don't know if he'd come on the show. Hell yeah, Lee Priest rocks. Abdul, is that Alush? Alrico? How does your face skin look so old? Oh, what a jerk. It's because I'm dieting, fucktard. Why would you ask that? Like, seriously, who actually says to someone, like, why does your face look so old? Like, no one would say that to your face. Like, I don't understand why people are so aggressively rude on the internet that they would never be in person. Zane has been mine. Lee Priest too. That's no BS. I'm going for it. At 5'8", I get it. Was a short kid until early 20s. Okay. Fucking A, I'm cool. Haha. Been shadow banned twice and YouTube jail twice. I keep it 100. Yes, he is cool. Anybody who society hates is going to be cool in my book. Jack Ryan. Hey, Todd, what's the great information? Keep posting. Central Bodybuilder from Australia. All right, don't listen to anything I say, Jack, because you have your balls make enough testosterone and your pituitary makes enough GH. You just need to eat clean and lift intelligently and don't use any drugs. Also, Jack Ryan is a cool character from Thomas Clancy's novels. I don't know if you're aware of that you don't watch the movies, read the books. Bull chain. Unless you watch the Harrison Ford ones. The 2 Harrison Ford movies are good. Teeth are a fad. The whole teeth thing has about run its course, right? What are you talking about? I like having teeth. What are you talking about? The teeth thing has run its course. I'm behaving on here to learn from the doctor. P5P for 19 or is the way to go. Personal opinion. Fuck Haber. I don't know what P5P is. Too harsh. Do you think part of the reason Pharma GH is so magic is that Chinese generics has dimers and oligars and other isomers that are pure? It is pure. That, I mean, the Metatropin is the only Chinese GH I've ever used, and it's 98.5% pure. And that the other 1.5% is when the 191 chain is in the bottle, I guess if you shake it in transit from China to the US, it can crack. And I've had it tested in China and I've had it tested in the US, and it went from 98.5 to 98. So you had 1/200th of the chains were broken. So it's not like they're filling it with garbage. It's that the chains break, which would happen with any GH. It's just nobody's testing the pharmacy GH to see if it's better. Didn't read it in a rude way. Okay, I'm sorry, dude. The bottom line is when you diet for shows, you lose the fat from your face first. And then, so it looks all hollowed out. But if you go back and you look at me from like 6 months ago, my skin doesn't look like this. It's not because of I got rapidly older. It's just because I'm dieting. So I'm losing a lot of water and fat at the same time. And then when I change directions, when I start trying to grow again, my face will fill out, but I'll still be leaner and I'll look a lot younger and my skin won't look as old. Priest is the man. Only one list that I can't handle anymore is Arnold. Screw your freedom. He took that back. He apologized. And I was pissed for about a year, but I got over it when he raised the prize money of the Arnold to $400,000. You know, you can't stay mad forever. It just hurts you, not them. Shane M, because Chinese cut costs and coins to make it cheaper. Not all. Okay, so let's put this right. Are all Americans the same? Are all Greek people the same? Not all Chinese people are the same. In fact, a lot of the people who are in China making the GH aren't Chinese. They're from the Middle East. So it's racist and to put down Chinese people, like either because like when Trump does it because the Chinese government sucks, or to assume that all Chinese people are out to hurt Americans. This is the propaganda that they want us to believe so that we're going to be pro-violence when the time comes. You know, if you watched Putin's interview with Tucker, he might be lying, but one thing he isn't is a fucking moron who shits his pants and can only talk about ice cream. That the point is that these other people that are our enemies are people, and they have valid points. When you try to see things from other people's point of view and try to translate their language into your language, and they're humanized, then you start to think that they're your equals. They're just different from you. They're not some alien race of evil predators, and hurting them becomes a lot harder. You actually want to cooperate with people. So to think that the Chinese people are out to hurt us, or that they're greedier or less scrupled than Americans, maybe it's true some of the time, but that doesn't mean that all Chinese GH is bad. That's why you send it to Gyno or someone else to get it tested and see, is this GH good? Because if you can get the same quality for 1/10 the price, you're a fool not to. Hollow last 2 weeks of prep. I think hollow, like my cheeks are hollow, and I'm not on the last. Oh, halo testing last 2 weeks of prep. It's popular. I don't understand the reasoning for it. That it's a testosterone molecule with a fluorine attached to it, so it's going to have some strong effects. I'm not sure what those effects are. And the thing is it has metabolites that are super, super androgenic. So it tends to make you really, really angry. And it's like, why are you doing this? Like, if you're going to have a good time, like a lot of people are like, I'm in it to win. I'm not in it to have a good time. I'm like, that's true to an extent, but we don't know that Halo is going to make you any better than Winstrol. So if you're going to beat up your girlfriend and go to prison, it's not worth it. Same thing with Tren. It's like, if anything that pushes you towards violence, like Tren or Halo, may not be worth it. What's your experience with Masteron? Man, Masteron's my favorite anabolic. I think it's the purest anabolic. It's the best anabolic steroid there is. You still need to have a testosterone base. I have plenty of videos about this, but the simplest answer is run testosterone between 20 and 50 milligrams a day. So your estrogen is exactly where you want it to be side effect free. Okay, so in range, if that's where you need to be, but if you can go outside of range and benefit from the extra benefits of estrogen without getting any of the side effects, then that's what you do. And then to fill in the rest of the gap, use Masteron. That is the simplest way to succeed, is using a small amount of test to get the estrogen you want, and then run Masteron as your anabolic and GH, and as much GH as you can afford for the most part. Oh, P5P is a form of B vitamin. How does this B vitamin make a difference with DECA? Like, what's the mechanism that this makes a difference? Imperium Rain, I just had to drop Mast, dried out joints too much. Love Mast though. So in this person, Mast is an AI. And in that case where someone was like having anti-estrogen effects for Mast, I would switch them to Primo and see if they can handle Primo better. And if they couldn't handle Primo, I'd switch them to EQ and see if they can handle EQ better. And if they couldn't handle EQ, I'd have them bring their test down really low and switch them to DECA and have them see if DECA works for them. All right, peroxyl 5-phosphate is what he means by P5P. All right, cool. Thanks, man. All right, appreciate it. My neck is the hardest part to lose, the puffiness. That sounds like water, but I don't know what you're talking about, puffy. Yes, haha, trying to eat clean and optimize training. At the moment, around 2 sets per exercise, 0 to 1 RIR. That sounds good. I would probably drop it down to 3 sets with 2 RIR, and you'll get more hypertrophy. Either by the Chris Beardsley effective reps model or the total volume load model. I think you'll get better results with 3 sets with 2 RIR. And you could go 2 RIR the first set, and then you'll end up getting 1 IR. Like if you try to go for 10 when you could get 12, then the next set go for 10, it's really 1 IR. And then the last set you go for 10 and you fail. So you got 2, 1, 0 RIRs. I think that would probably be a more effective system. All raws are made in China, even pharma. So it doesn't matter. That's a good point, Brian. So I don't know if all the pharma raws are made in China. I think Serostim's raws are made in Belgium, and I think genotropins are made somewhere else too. I think it's manufactured in Turkey. I don't know where genotropin comes from, but I think that the vast majority of the GH in the world is all made in China. That there's 4 GMP facilities, and a lot of the chemists that work at the GMP facilities in China have their own private labs, and that's where the generic GH comes from. It's not like you've got less honest people making it. It's just you're paying less money. It's like, I find it strange that people are so hell-bent on buying pharma GH and they won't buy generic GH, but then they'll buy underground anabolic steroids from China, but rather than buying the actual anabolic steroids from the pharmacy. Like, why is the difference between GH pharma and GH non-pharma considered so huge, but the difference between anabolics that are pharma and non-pharma anabolics not? And it's like, well, because I make my own anabolics, so I know they're good. I'm like, but you're still getting the raws from China. So it doesn't make any sense at all. And your food comes from China. Like everything in your house comes from China. So if they were going to poison you with lead, they would have done it already. What's this? Rizzo lifts? Yeah, okay. I love you, Todd. You're a good person. Thanks, man. I don't know what prompted that, but I'll take it. It's not the Chinese people. It's their government. That's the problem. And Brian Scruggs is correct. Okay. I miss Masteron. Give it a week ago. Love Masteron. Range for Winstrol at peak week. Highest you have ever taken. MG-wise daily. Okay, so the most extreme cycle I ever ran was, I think, 100 Tren ACE a day, 100 Masteron a day, 100 Winstrol a day, and 1 dimethyl Tren a day. Then the other one that was extreme was 200 Tren a day, 100 Winstrol a day, and 40 Halo a day. But the 40 Halo a day was only like 2 days. And I look better with the Masteron than with the double Tren. Anyone who doubts something masked should look at Wesley Vissers. Right, T plus massive, which is funny because Wesley reached out to me and told me how much he loved my show and my content. So it's like, if what I'm saying sounds familiar with Wesley, it's either because Stefan sees things exactly like I do, which it wouldn't surprise me because we have a lot in common, including our backgrounds. I'm into metal. He used to be in a metal band. I'm a doctor. He went to medical school. But Wesley also, it almost was like listening to myself, listening to Wesley talk to Paul about gear. And it was like either we have the same influence or we feed, or he picked something up from me or whatever, but it was very similar. So I think that where I learned this from, partially and mostly from John J3 University, and use code Todd5 for a discount. Enrollment starts, what day is today? So in 12 o'clock noon tomorrow, June 4th, you can enroll in J3 University, use code Todd5 for a discount. But yeah, I think John Jewett is the leading PED educator in the world. And that's where I relearned anabolic pharmacology from. And I think that might have been an influence for either Wesley or for Stefan. I'm going to have Stefan on next week, and we're going to discuss some stuff. Question: do you have experience on using Turinabol? No, I don't. I know it's popular with fighters, and I think it clears your bloodstream really quick. And that's why they like it so much. But I don't know if it has any use in bodybuilding. I think it's mostly a performance thing, not a size thing. Burzum Land of Thule album, your thoughts? I don't love Burzum. I've tried early on, I tried to get into it, I just never did. Salad 2K, Todd, a man of high culture. Do you have any book recommendations in the Warhammer? No, I don't have any recommendations in Warhammer 40K. I do want to get into it though. I just started, finally, I broke down and started watching Berserk. And Gundam. So I got Crunchyroll so I can actually go through. And I know that Warhammer is not anime, but come on. If you were going to make any anime, if you're going to do Warhammer right, I swear, you would have to do it with anime. That would be fucking sweet. All right. Did you see the reaction video Mike Van Dusen did on you after you commented back? He really walked back his insult and gave you huge props. Oh, thanks, man. Yeah, I didn't know that was his name. All right, guys, I'm going to be right back. I have to pee really quick. Oh, and I'm back. Oh, man, my lower back's fried from leg day yesterday. I'm not that old, I promise. Watch Mike is interesting. I love it. Berserker rocks. All right, so we got people on. Oh, we're at 71 motherfucking people. Woo! Getting more popular by the moment. All right, he's helping along. He's having a long piss. He's hanging along. Why the fuck are the words so goddamn small on this? What fucking child picked this font? Oh my God. Why the fuck is this so small? I almost need a producer to read this to me. How these fucking children that make these computers, man. All right. Oh, there you go. Bolt to chain. Dr. Lee, how to start dosage wise for GH. Looking for thin out and lose fat. It is something good concept? We'll have to use Lantus. No, you don't have to use insulin. This whole concept of blood sugar is based off the concept that you're unhealthy. So you have a bunch of extremely unhealthy people advising people on how to use drugs wrongly. And that if you have diabetes, you need Lantus. If you're pre-diabetic and you start blasting GH, you might start developing diabetes. But I guess that's your question. It's like, I'm already overweight. I want to use GH to lose fat. What I would do is take as much as you can afford before bed and then wake up and do fasted cardio using Wrath of the Valkyrie, because that's what I made it for, is pre-fasted cardio. And then you can take some Clen with it, assuming, okay, by the way, this is not medical recommendation, yada, 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 blah, blah, blah. This is for entertainment purposes only and education. Don't do what I tell you to do. But if I was someone who was overweight and I wanted to lose fat, I would watch the Dr. Todd Lee's How to Cut series. And in that series, I have not gotten to the whole conversation about PEDs yet. But what I do is I take my GH, I do 2 units fasted, and then I do my cardio. When I do Clen, I take my T3, I take 2 units GH fasted, intramuscular, not subcutaneous, because I want it to hit fast. Because they're the people who say, oh, it doesn't make any sense, blah, 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 it takes 3 hours. It takes 3 hours when you subcutaneously. It doesn't take 3 hours if you inject intramuscularly. Then I use Wrath, and I take extra Rahosine, and which will be in the new Wrath of the Valkyrie formulation, most likely. I'll probably stop using Yohimbine and start using Rahosine on the next batch. I'm going to test out both ways and see which. Supposedly Rahosine is better, but I feel like shit on Rahosine, and I don't feel like shit on Yohimbine, so I might leave it in. So anyway, Wrath plus Rahosine plus Clen plus T3 plus T4 plus 2 units of GH plus Anavar, pre-fasted cardio, and then I take the rest of my GH before bed. Now, I know that's not what your question is. For you, I don't know what you should do because I don't know anything about you. You should get a consult, though, and I'll help you with your problems. There you go. I didn't give you advice. No advice was given. All right. Take us back to your first bin. It was in I got Boldenone, and it came in like a little pouch. It didn't even come in a bottle because on paper, Boldenone was the safest of there was. And I didn't know what size needle to use. So I used a 19 gauge needle, and it hurt so fucking bad. And I didn't get anything from that cycle. What got you into? Nothing got me into PEDs. I'm not into PEDs. I'm using them to make me a better bodybuilder. Smash the like button. Let's fucking go. Yes, he's right. GH makes me tired. I take 5 IU before bed usually. Yeah, I mean, that's the right time to do it optimally to grow, or in theory to lose fat, because if you take enough before bed, it's still in the system when you wake up, so that when you do fasted cardio, it's already kicked in. If you take at least 6 before bed, you don't have to take anything any other time of day, really. I do, but I don't have to. I miss VAR too. The heartburn is too much. I'm not getting any heartburn on VAR right now. I do 25 pre-cardio and I do 25 pre-lift. I crush it up and stick it under my tongue. I usually use liquid, but I couldn't get my hands on liquid this time. So I'm just making my own liquid made out of crushed pill and spit. Oh, we're down for 44 again. We went from 71 to 44. What did I say? How did I offend people? Well, we've been on for almost 2 hours. I probably should get another meal in because it's my high day. And let me tally it up. Let me see how much I got. I wonder if you can see if I try to show you what I'm doing. Hold on. I had plus 96 from the beef, 24 from the pasta, and plus maybe 5. No, but we won't even put that in yet. And then over here we had plus 264 carbs, plus 42 carbs, and then we had plus 16 fat. All right, we're at 452 carbs today. We got a lot of carbs to go. So what I'm doing is I'm doing my log. I don't know. Can you see that? So under protein, if I click on protein, at the bottom here, you see that there's, where the fuck is this hand? There you go. See that? Rather than me trying to tally it up in my head, I can actually make it into a calculator and just put equal 52 for meal 1 plus 70 for meal 2 plus 95 for meal 3. And that's how I do my spreadsheet. And so here, if you look at the top, I fixed my rows and columns. So you can see the day, my weight, my adjusted calories, my total calories, my protein, carbs, and fat. And then if I can scroll over, and it can show you like how much steps I got. And I have a formula that I programmed into the spreadsheet so that 1/50th of the steps is negative calories. So my adjusted calorie column is the calorie column minus 1/50th of the steps column minus the cardio column, plus the cardio column. But I measure the cardio column as negative calories. And that's how I'm able to calculate my adjusted calories. Let's see. I think I left during the piss break. Oh. All right, fuck it. Got 5 kids. I'll go up to 6. All right, yeah. Now that you mention it, Liquid VAR didn't give me as much of a heartburn. Might as well make an order. Good pre-workout. Yep. Sublingual Liquid VAR. Remember, kids, the reason why you're getting heartburn from orals is liver damage. So either sublingual or injecting. That's how you get around that problem. Someone will argue with me and say, no, it has to do with the histamine release or it has to do with prostaglandin. Doesn't fucking matter. The point is, if you go sublingual or injection, you get around the gastric distress and most of the side effects, because rather than going for first pass liver metabolism and then getting to the body, it goes to the body first, then goes to the liver, then gets dealt with by the liver. So it's on second pass. Pinning is winning. Truth. All right, guys, I'm going to go get the rest of my food in. This was fun. I'll do this more often. All right, may the force be with you. Todd, my pin got stuck in delt. 31 gauge. Doctor advised keeping it in there as surgery would cause more damage. Yeah, I guess so. Buy a magnet? I don't know. That's beyond my scope. I've never heard of anything like that before. All right, guys. I will see you later. May the force be with you.